Over the last several weeks, governors in both parties from all across America have come together and pushed for a more robust and aggressive federal response. As chairman of the National Governors Association, we submitted several priorities to the President and Vice President last Thursday based on all of the important priorities of the governors. While we've seen some progress on some of these requests, including the invoking of Title 32 so that FEMA can cover the cost of the National Guard's relief missions and giving us the flexibility, and some progress on increasing efforts to ramp up the production of and delivery of PPEs and necessary equipment, and on extending the deadline for the 2020 census. We're still waiting for additional action on Title 32 for all of the states, and still pushing for the extension of the Real ID, and we're still pushing very hard for major economic stimulus and for monies to go directly to the states so that we can help these businesses and individuals that are impacted, and there's still no action on that. We're going to raise these issues again on our call with the President and Vice President this afternoon.
Governors across the country are on the front lines of this fight, and many of us are spending heavily at the end of the budget year, facing a significant decline in economic activity during this crisis. We desperately need these resources, and I look forward to working with our federal counterparts in the days and weeks ahead. This fight is far from over, but we are in this fight together. Look out for your fellow Georgians and pray for their continued safety, as well as the safety of our first responders, healthcare workers, the elderly, and the medically fragile. Please continue to follow the guidance of healthcare professionals by using best practices.
We all need to increase the physical distance between ourselves and others. The most valuable resource we have is time, and we need to create more of it by slowing down the spread of the virus. In Colorado, time that we can build our healthcare capacity, build beds, secure more personal protective equipment, more ventilators, more life-saving equipment, and better deploy those resources. That has been our challenge and our goal from the very beginning.
Every action that we've taken so far has been working to make sure we didn't have a huge spike in infections and people that are getting sick right away. That has been working, but also know that doesn't mean that we're not going to continue to have people get sick in South Dakota. The models that I have seen, again, indicate that 30% of our population could get infected. That is based on data, that's based on facts, that is literally tens of thousands of people in our state. And that is a reality that we all need to come to grips with and be prepared for, and know that the work we're doing today sets us up for taking better care of people into the future.
The 30%, would that be at one time, or is that over a length of time?
That's over a length of time, and that is why we're trying to spread out and slow down the rate of infection. And what we have been doing over the last several weeks is if 30% of our population were to get infected all at once, our healthcare system couldn't handle that.
The decisions that I've made have not been easy. I'm fighting to save our people, and I need every single person in Louisiana to be in this fight with me. We must flatten the curve in order to reduce the spread of the coronavirus in our state. We're not there yet. Everyone needs to follow the mitigation measures to minimize social contact and slow the spread.
Stay at home. Unless you're going out on an essential errand or essential work or essential business. Other states have recently come out with similar directives. Ohio has stay at home. Kentucky yesterday evening rolled one out. Illinois a few days before then. It's because we're all seeing the same trends or waves coming, especially in the dense areas, but it is spreading to all counties. So stay home. Get groceries only when you need them, and only buy what you need. I'm telling you, the next 2 weeks are critical.
These are obviously profoundly difficult times. I've had numerous conversations with people who have lost their jobs and their businesses, and others that are struggling mightily to keep their doors open as best they can and pay their workers. I also attended and spoke via live stream in 2 empty houses of worship at Temple Emmanuel and at Morning Star Baptist Church over the weekend. As we drastically limit personal contact and force organizations and people to stop coming together, I also sense a loss of purpose. As we all know, purpose is what drives us. Purpose is what fills our souls. Many feel lost, and I can see why. But here's the truth. We all have a role. We all have purpose as we battle this disease. Protecting one another from the spread of COVID-19 by limiting physical and social contact and staying at home is profoundly purposeful. Every single act of distance has purpose. Our first responders and emergency medical personnel, those who are essential to our success in battling this disease, need us all to do everything we can to reduce the spread. Reducing the spread honors these orders, honors and protects them and you and your family.